Hi, welcome back to Everyday Behavior. My name is Dr. Mary Ann Shepard, and this is our 16th series. And this month we are talking about the basics of early referrals. So when we're talking about early referrals, we're talking about early intervention, early referrals to things like speech therapy, occupational therapy, physical therapy, and autism evaluation, whatever that is. You want to make sure that you have an early referral because wait lists are long. And so the longer you wait to get a referral, the longer it is between when you get your referral and when you actually get seen for services. Some wait lists, like the wait list for an autism evaluation in some regions and states, may be as long as 12 months. And so you really want to make sure if we have concerns at 2 years that we don't wait until our 3-year well child visit, because then it means your child will be 4 or even older before you get that initial evaluation. And that's delaying services by up to 2 years. And so you really want to make sure that when you have concerns that you get those early referrals. Also, we know that early intervention is the best intervention. So the brain is constantly developing. And if we are intervening in those opportune windows when the brain is developing, then it leads to better outcomes long-term. So let's look at some of the basics of early intervention. So here are 6 tips that we're going to discuss in this month's series. The first topic that we're going to discuss is who you should request a referral from, what you should be watching for, when you should ask for it, why early intervention is important. So those WH questions of early intervention. We're also going to talk about if you are watching this and maybe you are a concerned grandparent, a concerned friend, or a concerned teacher, someone who has concerns, how do you compassionately talk to a parent about your concerns and encourage them if they haven't yet seen this series or had someone talk to them yet? How can you compassionately talk to them about your concerns and the need for early intervention? You want to be constantly watching for any early signs in infants and toddlers. That includes infants and toddlers if you're a daycare provider, infants and toddlers that you work with. If you are a family friend, what are some signs that you should be watching for in young children that maybe you love? And also, if you're a parent, what should you be watching for to know if your child may need additional services or an extra boost to get them started? Next, you want to watch for early warning signs in preschool and elementary grades. So teachers, often we know about those early warning signs, but we're going to refresh on some additional services that maybe you just haven't thought about in a while, or maybe you don't fully understand. But also for parents, we're going to talk about what are early signs that you should be watching for, or risk factors that you should be aware of, and services that are available to your child in those early grades. For teachers and daycare providers, it's important to consider early learning history when you're making those educational referrals. So all kids come into early education with a wide range of pre-educational experiences. So some kids come in and maybe they have been at home with a stay-at-home mom for several years. Maybe they've been in a home-based daycare. Maybe they've been in an unstructured center-based daycare, or maybe they've been in a very structured early education daycare center. Well, depending on which of those settings and the opportunities available in those settings, their early skills may look vastly different. And so you really want to make sure that you aren't just saying this child is behind other children, but you want to look at how can we evaluate if this is just a lack of opportunity to learn, or if this is actually a developmental delay. And then last, you want to follow up with your pediatrician and make sure that you're asking your pediatrician for those early referrals. So most referrals, in order for insurance to cover it, it will have to come from the pediatrician. And so during those well child visits, make sure that you express your concerns to the pediatrician. Make sure that you tell them all of your concerns, and it never hurts to go ahead and say, yes, please send that referral over. And if you get the referral and the evaluation and the specialist says, you know what, your child is on target, that's great. And there's no harm in that other than maybe a lost day or a lost afternoon from work and an extra appointment. But there really isn't a harm in getting an evaluation. And so if your pediatrician is requesting this or recommending that maybe you look into a specialist, then definitely go ahead and just have that referral and see what the specialist says. If you have that gut instinct and you're like, yes, I feel like my child needs a referral, go ahead and get that referral from your pediatrician, because again, the specialist may see something in that detailed assessment that your pediatrician didn't have the opportunity to observe in that brief well-child visit where they're assessing for a wide range of concerns. So always talk to your pediatrician and always pursue that evaluation if you have concerns. I hope that you find this helpful. If you want additional resources, please follow us on Everyday Behavior with Dr. Marianne at Facebook and YouTube, or at our website, everydaybehaviors.com. Also, here are some additional resources that you may want to look at. The American Academy of Pediatric Physical Therapy has a fact sheet titled The ABCs of Pediatric Physical Therapy that talks about physical therapy, what it is, and how you can prepare for that, or if you need a referral. The American Occupational Therapy Association also has a fact sheet about the role of occupational therapy in children and youth. The National Institute on Deaf and Other Communication Disorders has a fact sheet on speech and language developmental milestones, as well as the Centers for Disease Control has a resource for developmental milestones at various ages. So you can see kind of where your child is relative to those general milestones. All of our presentations, as always, are created in part with the Oklahoma State Department of Education, the Oklahoma Parent Center, and the Oklahoma Pediatric Therapy Center. And so we thank you for accessing these resources, and please subscribe below to receive further updates on when additional videos or resources are posted. Thank you and have a great day.